What is the schistosomiasis situation in Kenya? How does the disease affect the children?
So my name is Dr. Sultani Matendechero. I am the Deputy Director General for Health in Kenya, but previously I have served as the National Neglected Tropical Diseases Program Manager in Kenya. So schistosomiasis is one of the neglected tropical diseases that are endemic in Kenya. And we have both schistosomiasis hematobium and schistosoma mansoni prevalent in the country. Now, this is a disease that we have also seen is prevalent among quite a number of different demographics within those regions. It affects the whole population from the young children all the way to the older people, although, of course, children are much more, they bear the bigger brunt of the disease.
What actions are currently being taken against the disease in Kenya?
So unfortunately, where we are today, we do not have satisfactory, intervention strategies against schistosomiasis, because you'll find that we are over-reliant on mass drug administration, and not for the whole community. We are relying mostly on the donations that are available for school-age children, just to be able to reach out to that group. So we are leaving out, mainly we are leaving out the adults and the children under 5, the preschool-age children, because we are over-reliant on external donations. And so what is happening is that much as we know that we need to reach out to everybody, we are trying to come up with the innovations to be able to reach out to the other age groups. But we have not yet done much. We also know that we really need to do lots of water, sanitation, and hygiene interventions if we are to be able to effectively eliminate or control schistosomiasis. Unfortunately, that one is at a very minimal level. So passively, we see that schistosomiasis also benefits, schistosomiasis control also benefits from this passive improvement in the wash situation as the economic situation of the country increases.
How would a new treatment option for schistosomiasis for preschool-age children impact patients, their families, and communities?
Proposed new formulation that we are working on for pediatric praziquantel is one of those game changers. It's actually going to be a masterstroke in our efforts to try and control schistosomiasis and even to eliminate schistosomiasis, which some of us really believe is possible. And, it is something that will come with immense benefits. Because currently schistosomiasis is really interfering with the young children. They do not have any recourse. We do not have an intervention for the young children. It is a very sorry state, because when you go out into the communities, apart from the mass drug administration that we are giving to the school-age children, and even sometimes to the adult, the under 5s are completely left out, because there is no intervention today that we can target this group of people with. And yet it is a group of the community that is heavily affected by schistosomiasis. Actually, the young children are probably the most affected when it comes to the impact of schistosomiasis. So with this new proposed formulation, we expect to see profound impact in terms of even attendance of school, because whenever these children are affected by schistosomiasis, they take on the sick role. They are not able to go to school. They actually endure the suffering of the disease, the suffering that comes with being sick. And generally, they do not have the opportunity to prosper in the community. And then, of course, as they grow up, because some of them don't get treatment, they end up now suffering chronic effects of this disease. And even the bigger economy of the country is affected a lot by these cases of schistosomiasis because children are not growing to their full potential. So we expect even the knock-on effect of this formulation to be such that now when we are able to get these children to go to school, when we are able to get them to focus, then we expect that it will contribute to the economy, the growth of the economies of our countries, especially in the global south.
What do you think needs to be in place at a national level in order to facilitate and expedite access and scale up implementation?
Really what we desperately need now is to improve on the ownership so that we strengthen government ownership. As I said earlier, right now the emphasis, we are focusing more on external donations. So we need to see countries coming up to own these control and elimination programs for schistosomiasis more. We need to see some government funding going in. So a lot of advocacy required, better coordinated partnerships, even at country level, so that we can maximize. Number two, we also need to look at issues around planning so that we have proper strategies, even as we move forward, so that we can plan better, mobilize resources, towards these interventions. Even as the formulation comes in, how is it going to be sustainable? So that we have a mechanism where we have a plan, we have resources, we have sustainability to take us to the last mile. And then, of course, there's the issue of access. We also need to make sure that even as this formulation comes, we are able to make it accessible to all those who need it. So surveys to be able to identify those who need this formulation, we really need to do that. And then finally, it will also be very important for us to monitor and see the impact so that it can drive policy even into the future. And once we are able to see, once we are able to visualize the impact of this formulation, then I believe that that monitoring and evaluation framework will be a very important building block into the future.
GHIT Fund. Fight neglected diseases through partnerships.